Hello everyone. So our group today is going to talk about heart screening, specifically AAA screening. So we're just going to begin and talk a little bit about what heart screening is and what it does for us. And then we're going to go into AAA screening and specifically what that is and why we use it. Taking care of your heart is important. It is best to limit your risk factors and get annual checkups on your health status. This could mean just going to your doctor and making sure that everything is okay. For those who are at a higher risk for heart disease, it is important to monitor things like cholesterol and sugar in the blood, as well as blood pressure. Alterations in these may be a sign to go to your doctor and inquire about a test. If you feel like further screening is needed due to irregularities, then going in for screening may be necessary. There are many different kinds of tests, and each test is for something different. As stated by Bunat cardiologist, MD, for patients with 2 or more risk factors who are experiencing symptoms such as chest pain, shortness of breath, or irregular heartbeats, we would consider additional cardiac tests. Heart screening can help you identify heart abnormalities, as well as pinpoint the cause of irregular symptoms. When there is concern for what may be going wrong, screenings are a way to identify the problem before things get too serious. There is a variety of tests, as I mentioned before, so on our next slide we are going to talk specifically about AAA screening.
What is a AAA? AAA stands for abdominal aortic aneurysm, or AAA, and is when swelling/bulging occurs in the abdominal aorta caused by a breakdown of the aorta vessel walls. Many things can cause a breakdown of the aorta wall, including but not limited to age, older than 60 years old, gender. Males are 4 times more likely to have an AAA than females. History of smoking, diabetes, genetics, high blood pressure, high cholesterol, and trauma. A person who has had a AAA 3 out of the 4 times do not show any signs or symptoms. If they show symptoms, pain is the most common and usually the only one. The aorta is the main blood vessel that pumps roughly 1,500 to 2,000 gallons of blood daily from the heart to the body. When the aneurysm gets too large, it stretches and weakens the aortic vessel wall until the wall breaks, releasing hundreds of gallons of blood into the abdominal cavity, which causes internal bleeding, and death can occur within 10 minutes. On the next slide, we will go over different types of AA screening and who is recommended to get it.
There are many different types of AAA screening. These include echocardiogram, X-ray, CT scan, MRI, transesophageal echocardiogram, arteriogram, and ultrasound. Ultrasound is the standard approach to AAA screening. It is quick, painless, and non-invasive. It's similar to when pregnant women receive an ultrasound for a prenatal checkup. It takes about 15 to 20 minutes. Undressing isn't necessary, but the technician will need access to your stomach. A gel will be placed, and then a wand will be moved around on top of the gel. The most uncomfortable part about this screening is the cold feeling of the gel. However, it is possible that the technician will not be able to see the aorta clearly enough, but this just means that a new appointment needs to be set up, and the same exam will be performed at a later date. Men over the age of 65 are recommended to be screened for AAA. Women are generally not at risk for AAA, so they are not recommended to be screened, as well as men under the age of 65, or people who have already had AAA.
Benefits and screening. Benefits to screening for AAA is there is a lower chance of the aortic abdominal aneurysm bursting and causing bleeding in the abdomen. If you catch the AAA early, you can either monitor it or have surgery to remove it. For screening, the screening process for an aortic abdominal aneurysm is to have an ultrasound done on the abdomen. The screening process takes about 10 to 15 minutes to complete, and results are immediate. The results of an AAA. No aneurysm. The aorta is less than 3 centimeters wide, and there is no need to monitor for AAAs. Small AAA. The aorta is 3 to 4.4 centimeters wide and are monitored every year for change in size. No need for surgery at this point. Medium AAA. The aorta is 4.5 to 5.4 centimeters wide and will be monitored every 3 months for changes in size. No need for surgery at this point either. For a large AAA, the aorta is 5.5 or more centimeters wide and has the highest risk for bursting. You will talk to a surgeon specialist for treatment options.
Our questions are: number 1, what is an AAA? A battery, American Automobile Association, an abdominal aortic aneurysm, or Alcohol Awareness Association. Number 2, who needs to get screened for an AAA? Men under 65, men over 65, women, or people who have already experienced an AAA. And here are the references we used to put together this presentation. Thank you.